Hello, everyone. Hi, Jihan.
Hi, Dr. Roshan Ahmed. Welcome today. Nice to meet you. I'm very happy to have you today. And I think everyone is excited to learn from you. So I will give you to speak.
Awesome. Thank you. Pleasure being here. So let me start. Awesome. I can see my slides. So, hi, everyone in Morocco, in El Jadida. It's a pleasure to be joining you virtually today. I live in rainy but beautiful London. I know you have much better weather now. I was talking to Jihan before. About myself, I'm Roshana. I'm a lead data scientist at IBM, and today I'm excited to talk about how we can unleash the power of Gemini to personalize disease treatments. I'm sure you heard about Gemini, great LLM model from Google, and now we want to talk about the Gemini version of that. So please note that while I work as a data scientist, my talk today is based on my personal interest and exploration in the field of AI. A bit about myself. I hold a PhD in computer vision and image processing with a long background in medical imaging. Besides my role as a data scientist, I'm passionate about empowering women in tech and innovating with Google Cloud. So I'm a women tech maker and a Google Cloud champion innovator. Feel free to connect with me on LinkedIn if you have any question, and follow me on YouTube channel for more AI and tech content. To start, and before we delve into the technical details, let's establish a fundamental understanding of personalized medicine. It's about customizing medical treatments to individual patients, considering their unique genetic, environmental, and lifestyle factors. As we can see in this figure, people are having different demographics. But when it comes to medicine in general, we look at human population rather than each individual. And this figure shows that although people are different, they all go through the same treatment as soon as medics classify them for a specific disease. The truth is they get different responses from the same treatment. I mean, due to our differences, we can expect that the treatment has different outcomes for different individuals. But how if we are able to study each individual better with a specific to their differences, and then we can provide them a specialized treatment for each individual. And instead of seeing no effect or even adverse cases, we maximize treatment for everyone. Now let's think how if we merge all this available information we can obtain from an individual. For example, the patient's genome data, their demographics, their medical history, imaging scan, and their lab tests, that each individual will have different from each other. If we can merge them for each individual, then merging this data, although it's difficult for us as a human, but AI can change the future of the medical treatment as it has the ability to find the patterns we are looking for from different data sources. In personalized medicine, we are moving away from one-size-fits-all approaches, but this transition comes with complexities, such as handling diverse data sources and making accurate predictions. let's look at this one, AI-enabled computer vision in healthcare, which is the convergence of AI and visual data analysis. In healthcare, it's a game changer. We are talking about systems that can extract meaningful insights from medical images, such as X-rays, MRIs, and CT scans. These insights translate into more precise and personalized diagnosis, but we are not stopping there. We are leveraging AI's power to enhance radiotherapy too. If you're not familiar with radiotherapy, let's talk about it. And let's say that patient has a cancer and doctor decides to have radiotherapy as the tool of treatment for them. We can see how AI is used in this field. Radiotherapy is conducted by these kinds of machines devices that we can see in this slide, which is called linear accelerator, or LINAC in short. And radiation therapy, or radiotherapy, is basically a very common cancer treatment that uses high doses of radiation to kill cancer cells and shrink tumors. The radiation beams conducted from this device, LINAC, kills cancer cells or slows down the growth of the cancer cells by damaging their DNA. This slide might give you a better understanding of what is the whole process of radiotherapy in case you guys are not familiar with. I worked in the field of radiotherapy for a long time, applying AI to improving radiotherapy. So for you guys that might not have understanding of that, I want to show the whole process in very abstract version in this slide. If you look at the first image, we see that the 3D medical images are acquired to visualize the internal organs of the patient for the doctors. Then, in the number 2, we see an expert radiotherapist who has been trained for many years, sits down and draws the tumor shape on each 2D slide. Then, with the shape doctor delineated before starting the treatment, we can plan the treatment. If we go look at the number 3. The treatment is done in many sessions. For example, for lung cancer, it can go to 30 days, sometimes around 4 to 6 weeks. Just remember that the radiation is done with the same shape during all this time. So we hope that the tumor shrinks, but it might not be the case for every patient. In stage 4, you can see the LINAC. There are nice videos I put here, but I'm not able to play them. But I want you to focus on the images and understand that this LINAC, this device for radiotherapy, rotates around the patient to deliver the estimated dose to the tumor. The lower image shows that the collimator leaves change shape to adjust beam shape from different angles. So, although we can see lots of advances in this field and lots of time and advances has been done, we can see that there's still lots of computer vision applications involved, such as image segmentation, registration, and so on. But why not all patients respond well to the radiotherapy? Even patients suffering from the same type of disease, they respond differently to the radiotherapy. And this brings us to study this more. And if we look at this picture, we can see that it tries to visualize what I'm trying to tell you better, basically. Look at this. There are people who get bad skin reactions, terrible bruises after the radiotherapy, after the same treatment. Why this happens? It can be because the amount of dose we deliver to different people with the same disease should not only rely on their tumor shape or type or volume. Maybe other factors we should consider as well, like their gender, their skin color, and some other factors that can impact the treatment as well. Let me go to the next slide. Awesome. So here, I want to show you that radiotherapy plays a very important role in cancer treatment, and especially in personalizing. It can significantly improve patient by personalizing it. It can significantly improve patient outcomes. Personalized radiotherapy tailors treatment plans to each patient's unique anatomy, tumor characteristics, and response patterns. AI-enabled computer vision steps in the analyzing medical images such as CT scans to precisely identify tumor boundaries and critical structures. This accuracy empowers us to optimize radiation doses for maximum therapeutic effect while minimizing harm to healthy tissues. But there is even more information we can leverage for each patient's benefit. Demographics, such as their age, their gender, play a role, but we can delve deeper into the details like skin color, which can impact radiation absorption and dose distribution. In personalized radiotherapy, we are dealing with a wealth of data, medical images, patient records, their genomic data, and more. Integrating these diverse sources is no small feat. The idea of a unified multimodal AI model comes into play. Imagine a model that interprets CT scans alongside patient's history and genetic information. This synergy of data opens doors to highly tailored treatment plans. And here's what it gets exciting. MedGemini is a new family of multimodal medical models developed by Google Research. It builds upon the fundamental capabilities of the Gemini language model, including language and conversations, multimodal understanding, and long context reasoning. MedGemini is further fine-tuned to make use of web search for current information and can be customized to novel medical modalities through the use of modality-specific encoders. MedGemini can perform various tasks like medical image classification, question answering, and more, all using the same set of model weights. This versatility translates to competitive performance, often surpassing specialized models. Imagine the potential of such a system in generating personalized radiotherapy that I was talking about, the planning of the radiotherapy as well as the treatment recommendation. MedGemini 3D is able to generate reports for CT scans, a far more complex form of imaging than standard X-rays. In this example, MedGemini's 3D's report has correctly included a pathology information that we can see it's been highlighted in green that can be missed in the original radiologist report. By integrating this information with the latest medical research and clinical guidelines, MedGemini can generate highly personalized treatment recommendations, increasing the likelihood to successful outcomes and improving patient care. Now let's envision the application. AI-powered computer vision, powered by models like MedGemini, can revolutionize personalized radiotherapy, personalized medical treatment. Imagine the system analyzing CT scans and patient records, precisely delineating tumor boundaries and critical structures all together. And as a result, we can have the optimized treatment plans that minimize radiation exposure to healthy tissues and increase the chances of successful outcomes for each patient. And as we look ahead, the potential is huge. Generalist MedGemini models can reshape personalized medicine and radiotherapy. However, changes lie on our path, from ensuring data quality to gaining regularity approvals. We must foster collaboration among AI experts, medical professionals, and regulatory bodies. Research and validation are crucial, of course, to realizing the full potential of AI in these domains. Thank you for your attention. I'm open to any question you might have. Feel free to ask me. Thank you.
Yes, thank you. For me, my question is about what are the limitation of MedGemini on this, and what are the going efforts to improve its capabilities?
The limitations?
Yeah.
Okay, the systems are still okay. It really depends on your application. Just as the same as the normal language models that they are still developing. The medical version of that, like Gemini, is great. Is my favorite LLM model, but we can see it still needs improvement. We have to specifically, if we need to use it for a specific task, we have to fine tune it. So I believe it's the same can be for the MedGemini. So maybe there is a specific type of imaging data that is not being trained on, or it was not included in their training. Maybe there is a specific demographics of people which were not included. So the more data we have and the more fine-tuning we do, they would be optimized.
Yes. Thank you for this.
No worries. I hope it was the answer to your question.
And do you think this economy have the potential and the social impacts of to adopt AI powered personalized medicine?
That's a very general question. It depends which economy we're talking about. But as a researcher, as someone who's done research in this field, I can assure you it would have a lot of impact on personalizing medicine in general, whether we go with these new tools like MedGemini or because traditionally also people were looking at personalized medicine. It has a lot of impact. Would it be more computationally more expensive? Definitely, but we have to do the comparison of the cost of that. That if we are not considering, just this unified model, if we don't spend time, energy on using this, how can we compare this with the cost of treating patients wrongly, doing additional treatment for them? So I think we can argue. And to me, this personalized one, especially these smart models like Gemini, are the winners.
Yes, nice. So for me, this is all the question we got. Thank you for this amazing presentation about unleashing the power of Gemini to personalize disease treatments. I hope you have like a great time with us.
Thank you so much, Jihan. It was a great time. Thanks for inviting me. And hopefully one day I'll see you guys in person.
Yeah, inshallah. Thank you.
Looking forward to it. Take care. Have a lovely evening. Take care.